Rajayakshma is the Swatantra Vikara. Then, in our current lifestyle, you see, we find many types of this Pratishaya Vikaras, which are mainly with this Achaya Purvaka type of manifestation. Mainly, see this Asadmya Gandhan, or even the Shiloshna Akrama Sevanam. These sort of things can trigger a Pratishayam all of a sudden. They are very quick to manifest. Whereas in conditions like the classical ones which we find with this even that Avashyayam is actually this mist or fog or whatever that form of snow what we experience in the winter. From the west, if you see patients, not even the west, I think in many cold weathers, you will find that with the onset of spring or sometimes in summer, I think this Rajas, Pushpa Rajas, all these things will immediately trigger a lot of Lakshanas along with the Pratishaya. And they are forced to take some sort of a anti-allergic medication. So a broad spectrum which is otherwise known as allergy is causing this sort of achaya. But I think while treating these conditions, I have a different opinion. See, Visham can cause this, Avashyayam can cause this, Avak, Shaya. These are all very common things. These are all, especially with the widespread use of this information technology and mobile phones, I think these are not unusual. As somebody told, I think even the human posture has become like the F of the Facebook, isn't it? I saw some cartoon like that. Human posture has become like the F of Facebook, because always the head is bent towards the screen. So this is creating a lot of issues, postural. One among them, among those many is Pratishayam, Shavadu, Apinasam, Prashakshavaha. All these things are coming under these equations. And there are some hidden points, hidden or overlooked points while considering Nidana. I will come to that. See, this postural corrections I have already mentioned, but sedentary life is very important. Sedentary life, generally, see, we tend to focus on the sthana samshraya or the sthana vishesha. It creates a lot of problems with the jatru. Then we try correcting the neck posture, then start doing some sort of exercises for the neck, many things, posture corrections. But you see, sedentary lifestyle is dangerous because it constantly creates Vada Pratigomyam. The Apana Samana Pratigomyam. This is very dangerous. And the Vayu running away from its normal positions upward. That is what we call as Udavartam. We should focus on one beautiful explanation of Udavartam, which is explained as Ashwarova Upadrava by Vakpada. Udavartam is explained in multiple authors and multiple styles. But please focus on the Udavartam as it is explained by Vakpada as an Upadrava of Arshas. Mudra Kodrava Jurnaho Karira Charaga Janaga Vihi Kodrava Yudara Vishtarnehi. We will find that sort of an explanation there. And you should see the spectrum of Lakshanas given there, of which Prenasam and all those things are there. There the mechanism is because of the sedentary lifestyle, continuous fitting and the Vada Rodha by the Arshas in a mechanical manner. And that pulls lot of Pitta from the Koshta to the Jatru, which makes the Kapha in the Urdhva Kaphasthana asthira. We were mentioning about the Urdhva Kaphashaya. So the sthirata of Kapha in the Urdhva Kaphashaya is so crucial in the maintenance of Sharira. Which is the kapha specifically situated in the Urdhva Kapha? It is Tarpaka. So the sthira guna of Tarpaka is so crucial in the sustenance of our Sharira. This is so important. And asthira, unstable, asthira Tarpaka kapha can create Jatrurdha Vigaras and Sarvadehika Vigaras, specifically Jatrurdha Vigaras, in many ways. If you look at the Vadasodhana Nidana, you will find that Pranagoma Nidana. In Pranagoma Nidana, Vegarodhan is there and many other things are there. And one of them, the presentation is Penasam. So this is caused by Asthira Kapha creating Margarodha of Prana. Asthira Kapha in the Jatrurdha, and that Asthira Kapha in the Jatrurdha is a result or reflection of the Rasatha. It is a reflection of the Rasatha. It should be related with some sort of a Sthanika Staulyam. It will not manifest as the Staulyam of the Sharira, unfortunately. The head will not start swelling up like obese people's body. If that was happening, I think it could have been quite weird. If the Staulyam happens to the Jatrurdha. But the mechanism of operating behind it is something similar. Gurvali Vruddha Samlina Shleshma Mishra Annajo Rasaha Ama Eva Sladhi Kurvan Dhadul Staulyam Upadayed. This is the Saulya Samprati. Gurvali Vruddha Samlina Shleshma Mishra Annajo Rasaha Ama Eva Sladhi Kurvan Dhadul. This sort of a sladhanam is happening in the Jatrurdha, creating asthira tarpaka kapha, causing problem with the normal passage of pranavayu in the Jatrurdha. This pranavayu can create a peculiar type of spectrum of diseases, of which Pratishaya is one. Then again, the mechanism should not be concluded or confined to the Jatrurdha. Sir told it. The importance of looking into the status of Agni. This is very important. Another is that Mayudatmana Siraha. That's what the word came. That is more of a Vada predominant Pratishaya. So anything where Mayudatmanam is happening, Atmanam is some sort of a swelling up. Mayudatma, the cirrus, again the cirrus is not going to be blown out like a balloon. Where is it happening with Mayudatma, the cirrus? It is happening in the level of srodhasis. So when the srodhasis are, when those srodhasis are occupied by you, that is explained in Vada Vyadi. When there is emptiness in the srodhas, Vayu occupies that, creating some sort of a Atmanam. And that Atmanam is going to drive the Sonika or Pitta or Kapha, creating Pratishaya. That is why Vayu Pratishayate Pratishaya. So according to the factor influenced by this Vayu, which is occupied and Kupita in the empty srodhasis, is going to create the Pratishaya. That is another Samprapti which is happening behind this Pratishaya. Then in that case, Atman Vayu can be because of Rukshara. Sometimes what happens is Jatrurdha is having srodhasis which contains lot of elements which accommodates your Medha, Buddhi, Dhi, Dhriti, all those things. When you go through some sort of a digital life 24/7 in the social media, the latest word of the Oxford dictionary is brain rot. Brain rot means your brain is becoming good for nothing. there will be an empty synthesis in that process, and that also can cause Marilatma Siras. So brain rot can cause Marilatma Sirastvam, and that also can cause Pratishaya. So when you are getting confined to the social media 24/7, that is also going to be a reason for Pratishayam, because of it creates emptiness in the Jatrudha, emptiness in the first floor. First floor can be rendered out, nothing inside. So that is also a dangerous possibility. So all these factors are to be brought together. Again, focus on the Swatantra, Paratantra factors, Nija, Agantu factor, and plan the treatment accordingly. That's all. Now coming to Dustapratishaya specifically, see, Dustapratishaya is having a peculiar nature. Apart from the dosha dushti and the sroto dushti, it starts creating problems with the dhadus, especially the uttana level of dhadus. Rasam Raktam Mamsam Hedas maybe up to Asti. No Asti involved in general, but at later points even that can be involved. So this Rasam Raktam Mamsam Hedas, these are the favorite recipes of or the favorite substratum of Abhishyanda. What we were expressing earlier. Rasam Raktam Mamsam Hedas is the favorite substratum of Abhishyanda. And when there is Abhishyandam, see, this Abhishyandam is again, I'm bringing Abhishyandam to Pratishaya in a short while. I think I will close it fast. Abhishyandam is that way when it spreads to Rasapraktam, Mamsam and Vedas. It can be categorized as a stage of a peculiar type of kledam. Peculiar type of kledam happening. This dushta kledam is a transitional zone between Nijarogas and Agandurogas. Dushta kledam is a transitional zone between Nijarogas and Agandurogas. How? Wherever this Dushta kledam is there, is manifesting, it will attract these Jandus. So wherever there is accumulated Dushta kledam, it brings Krimi into it. Krimi as such is an Agandu factor. Krimi as such is an Agantu factor. How does this Dushta kledam manifest? It is because of a pre-existing Nija dosha sthiti. It is because of a pre-existing Nija dosha sthiti. So, there is some sort of a meeting phase of a pre-existing Nija dushti inviting an Agantu factor. Where? In the Dushta kledam. So the Dushta kledam is a meeting place of both Nija and Agandu factors. So in Dustapratishaya, the Kevala Pratishaya is developing into a stage where there is abundance of Dushta kledam hosted by Rasarakta Mamsa Vedas, attracting krimis. And when this happens, the entire ojas will be focusing on that particular war field, because it is going to terminate the individual, finish off the person. So what happens? Body's all innate, inherent, accumulated Vyadhi Kshamata will be focusing on fighting this particular war field where this Nija Agandu factors have come together. So what happens? the portion on entire body is cut. Whatever little bit rasa you make, that will be directly promoting the ojas, and that ojas will be burnt off in the war field. So what happens? There will be severe possibility of a kshaya. So two things. Dustapratishaya, unattended. Pramada, we did not care in the beginning stage. Dustapratishaya manifested. A war field, a peculiar war field is set where Nija and Agantu factors come to a coalition government. Entire ojas is burnt off to fight of that situation. No portion to any other dhadus. Kshaya manifests, Krimi manifests, Vardhamanam Kshaya Pradam, and Yakshma Krimi Kramam Kurvan Yavaye Dushtabhinasam. This is the scene, what is unveiled while we look into the Dustapratishaya Samprati or the picture. So you will have to consider and sort out these things one after the other. First you have to focus on the status of the Nija, bring them back. You have to focus on Krimis, which are the Agantu factors. Yakshma, all the Krimi Chikitsa. In the Amashya Krimi, you will find the Pratishaya as Yakshana, which is easily going to become Dustapratishaya. So attend Krimi. Then Agni, Balam, Ojo, Prithvi. And even if you go through all these things, once attacked by this peculiar samprapti, the preliminary dhadus, the utthana level dhadus in the sharira will be some sort of a morbid to receive the same samprapti again and again. Dehe margi krite doshaihi nivrittovi punarvyadhi alpenayadhi hetuna doshe dehe margi krite doshaihi. So your deha has already become margi krita. It is margi krita by the dosham. So even with the simplest reason, it comes again. That is why it is becoming a yapya vikara. So anything which is needed to contain the kleda in the rasaraktamam samedas, anything which is required to keep the krimi away, to bring the rakta shuddhi and rasa shuddhi as early as possible, to bring the repair of the mamsa and vedas to the best level possible, to reinstate the status of srodas in the Jatruda as early as possible, and bring Balya Rasayana factors immediately. This will be the strategy of managing Dustapratishaya from an overall view. I think Uday Shankar sir may be adding something specific to it.
Thank you. There is also many common factors in the management of Abhishyanda as well too. Dushta Kleda, there is a major factor in Abhishyanda. Almost it has repercussions on Dustapratishaya also. Because in both the diseases we have a common type of management, or in principle both are similar. For example, in dealing with Abhishyandas, we have local treatments and systemic treatment. Sankshepata Kriya Yoga, Nidana Parivartana. Nidana Parivartana stands for not only the factors mentioned here, but also Patya Sevanas. Nidana Parivartana plus Patya Sevana. That helps for the first line of treatment. Second line, Doshadinam Pratigata. Doshadinam Pratigata, again, we should consider at two levels. One is at the local level, like in Abhishyanda, we have first group of treatments, earlier treatment groups and later treatment groups, like Navabhishyanda or Ama Abhishyanda. This is a progressive stages. Navabhishyanda, then Ama Abhishyanda, Bhakva Abhishyanda, and the complicated stages of Adimutta, those things. So this is a progressive stage. Similarly, in case of Pratishaya, we have Navapratishaya, Amapratishaya, Bhakva-Pratishaya, Dustapratishaya. These are all the progressive stages. Our treatment, or guidelines for treatment in Navabhishyanda and Navapratishaya are almost similar. We have to make Navabhishyanda into So Ama Abhishyanda to Ama Netraroga to Nirama Netraroga. Here Ama Pratishaya to Pakva Pratishaya. The approach is similar, like Pachana, Deepana, Langana, Tiktarasa, like how we are doing in Jora Chikitsa. Similar line of Pachana measures should be applied in both Abhishyanda and Pratishaya. Then about the local treatments. Local treatments, we have 7 types of Kriya Kalpas, in which that Laxmi Patil is the supreme authority here, and she has demonstrated many of the things for us. And among them, Vidalaka and Pindi is the first approaches in acute cases. We can do the Vidalaka or Pindi, or then we can do the Prasad, Parishad or Aschotana. Then we can go for the later stages, like when it has become Pakwa, we can go for Anjana, then Tarpana, Putapaka. These are the progressive treatment approaches, the local treatment approaches. Whereas in Pratishaya, in the earlier stages, we should not do the Namadanasya. We should start with the Pradhamanasya or Nishpidana of different dravyas to make the Navapratishaya into Pakwa Pratishaya. With all this internal and external method, it becomes Pakwa. When it becomes Pakwa, we should take care that we should not go for the Dustapratishaya stage. At that time, we have different types of Asavanasya or Kashayanasya, so that we can remove the Pakwa doshas outside. We have specific drugs which we know that Shukyadinasya or Katfaladinasya, various types of Nasya yogas are mentioned in different types of textbooks. And finally, we should have the Rasayana Chikitsa in both these things, because Nidana Parivartana and Dosha Pratigata and Rasayana. Rasayana is most essential part, so that either Abhishyanda or Pratishaya will not recur. So we should also include different types of Rasayana. In the Rasayana, there should be some internal medicines, like we are all aware, Haritrakanda, or various types of Pushmanda Rasayana, and many types of Rasayana, Chavana Prasha, Vyadri Haritaki, Chitrak Haritaki, Agastya Haritaki. In many of these things, Rasayana yoga should be given simultaneously. The patient should avoid the Nidana factors and also follow the Sadgurutta, Dinacharya factors, like in case of Abhishyanda, local hygiene of the eyes, like it may be Anjana or Netra Parishad. Those things should be maintained so that you will not be affected by the external factors. Similarly, for Pratishaya, in the Rasayana Yoga, we should start with the Pratimashanasya, so that it will not relapse. Not in the early stages. Many times we feel that when the patient comes with the Nasa Yoga, start with Anutailanasya. It should not be done. Anutailanasya should never be started, or it should never be given in the early stages. It should be as a Rasayana or the preventive measure. This is actually Swasthavritta Chikitsa. So in preventive measure, you can ask the patient to give Pratimashanasya regularly. So in both these things, there are many things which are common and many things related to the local factors only. And by and large, in both Abhishyanda and Pratishaya has some common approaches related with the management of Vata Prakopa or Vata Anulomana. In both these diseases, our aim should be Vata Anulomana. Vata Anulomana helps for the reduction of Dushta Rakta or Dushta Pitta from the Siddhanasari Dosha, Tigunai Pursamagati. Whichever has gone up will be reduced or descended by doing proper Vata Anulomana. In case of Pratishaya, again, Vata Anulomana is the main, our idea in the treatment guidelines. So, with these words, I request Professor Prasad sir to conclude this session with this practical experiences of different yogas in the management of these two diseases. Thank you.
So overall, I feel that we had a quick but elaborate view on two major disease conditions, Abhishyanda and Dustapratishaya. So in the beginning, Dr. Saurabh was saying that even though they by name they represent two small conditions, in the ocean of Ayurveda. I think while we start discussing, we can understand that they mean a lot. So I think fortunately we had a very good sync between the panelists. What Sir was saying helped me to take it to the next level, and what I told helped him to take it to the next level. So we had a very nice understanding of Abhishyanda and Dustapratishaya. We understood that they should not be understood or considered as confined to the Jatrundva. They are reflections of changes happening in many other places. And the basic rules like Samaprabhava, Doshanam, Sarvesham, Agnihetu, that sort of basic understandings should never be overlooked. And considering that we are specialists in Salakitandra, we should not neglect the Sharira as a whole, the beauty of Ayurveda of seeing things in totality, that should not be overlooked. And with this idea, I think we understand that Abhishyanda is a Samprapti which is, see, the captain of the show or the hero of the show is Pitta and Rakta with the support of Kapha. Whereas in the case of Pratishaya, the hero is Vayu and supported by the other doshas as and when required or according to the role that they have to play. So basically I think all the diseases listed, populated under these two separate headings of Nasa Rogam and Netra Rogam can be beautifully organized under these major titles of Abhishyanda and Pratishaya, and they have got direct connections with the Samanya Samprapti as it is explained in Sarvaroga Nidana or in the Sutrasthana, as I mentioned that Saeva Upido Doshaha Samuthana Visheshataha Sthanantarani Samprapti Vigaran Gurudeva. These are the lines which are to be kept embedded deeply, imprinted deeply in the minds or in the prajna of the Vaidya's information. And they should start using, they are not supposed to be framed, laminated and framed and kept in the backyard of the prajna, but it should be in the forefront of the prajna, and they should not be laminated. We should be able to take it as and when required and use it very liberally in our all clinical situations. So I think that is what I would like to conclude. So when you start doing more and more with your clinics, keep this idea work, let these ideas work, and get convinced by the beauty of their application or translational value. That's all. Thank you so much.
Thank you very much, sir, for this wonderful explanation. I once again thank both our respected speakers who have thrown light and who have discussed very elaborately regarding Abhishyanda and Pratishaya. Actually, the thirst or the trishna for Abhishyanda and Pratishaya will never quench, at least. But we have to conclude now. The session is open for questions. Some of the questions will be displayed on the screen, and most of them have already been discussed. Apart from those questions, if you have any, you can ask to the speakers. So first, the similarities of clinical presentations of Pratishaya and Abhishyanda and the differences already it has been told. These have been discussed. Next slide. Third question. Yeah, even while telling about Samprapti, the third question is regarding all the three acharyas and they are telling different ashrayas of Pratishaya. It has been discussed. Even the concept of Sutta Abhishyanda is discussed. Lakshanas. Now this is a new thing. So, considering present day's trend, especially this question was there in my mind actually because of my students. I only have added this question regarding Vidya Karma, the practice of Vidya Karma It has been a trendy practice nowadays. So can you show some view, or can you give some opinion regarding Vidya? Okay, sir. So Sthanika Chikitsa and all it has been discussed. Last. So any other important formulations, effective formulations in your practice? Specific formulations for both Abhishyanda and Pratishaya. If you want, you can share on the dais.
See, this Vardhamana Pipali, which is already mentioned. Vardhamana Pipali is very unique in many contexts, isn't it? Vardhamana Pipali is quite challenging as well. We need the support of many things, Kalam, the Ritu, the other facilities, all should work together. Then only you can do this beautifully. And Vardhamana Pipali is not something like a Amrita Prasam or Pushmanda Rasayanam, something like that, which are all basically Madhura Rasayanas. This is an extremely Kadu Rasayana, isn't it? So this Kadu Rasayanas are focusing more on bringing Srodha Shuddhi and uninterrupted Rasa Pushti. Uninterrupted Rasa Pushti, Rasa Vitaranam or whatever it is. So it can be done specifically in that condition only. And the Dravya is specific. Dravya is specifically given in Vada, Vata Kapha, Kapha predominant conditions. Not in Pitta, Vata Pitta conditions in general. It is not meant for that situation. Similarly, I think in my practice I use only very simple yogas. This Vardhamana Rasa, Pipali Rasayanam is not a common practice. Only in selected extreme conditions to conclude the treatment we go for this sort of Rasayana. In general, I think like Krimihara Chikitsa is very important. So Krimihara Chikitsa we use Vidangadi Kashayam, Vidanga Kandulavi Churnam, or this Vidal Veravi Kashayam. These are the Mani Bhadragulam. These are the commonly used Krimihara Chikitsa. We also use Vishahara Chikitsa in this Klega Nirvana and Krimiharana. For that we generally use this Neeli Tulasyadi Kashayam or Dushi Vishadi Gulika, Vidvadi Agadam, Vidvadi Gulika. This to start with the treatment and give some sort of a simple Nitya Virechana. And in situations where we feel that there may be a sustainable or a continuous Pitta Vritti, we use a very small quantity of Avipatti Churnam for a daily use. Very small quantity, 2 grams, 3 grams, like that, not in a Virechana Matra. And we use Arkams, different Arkams for Nasya Prayoga, like Nirgundi Patra Arkam, especially Nirgundi Patra Arkam we use. And considering the status of Tattvaga Kapam in the Jatru Urdhva, we use Talam, application of either in the paste form or in the oil form on the crown of the head. Different types of Talam. And also use special Dhupa Vartis, this Bhumapana Vartis, like Elavi, Bhumavarti, or many other things may be there. So these are also widely used to contain this Klegam and Krimi in the initial stages. Then obviously we go for Rasayana.
Thank you, sir. So any other questions from the delegates?
my question is about the Arka Kalpana you have mentioned, Nirgundi Arka. So what is the dose of Nirgundi Arka? Like, are you using it as Pratimarshanasya or
we use it in small quantities. Even technically it cannot be called as Pratimarshanasya because Pratimarsha is specific to Sneha. So this is not a Sneha drava, it is something like a drava only. So we use in very small quantities like 2-3 drops or 3-4 drops 2 times a day, morning and night, bedtime, like that.
So how long you are using this Nirgundi Arka specifically, sir?
As long as the situation demands, for months together, even after controlling the main samprapti, I think this can be continued for a few more period, a few more weeks, so that you can bring or get immediate Srota Suddhi.
Sir, regarding the preparation of Nirgundi Arka, is this prepared by yourself or is a company?
Yeah, one of my friend who is making it exclusively for me. It is not available in the market, we have to prepare.
Can I know the water composition of this?
Generally all arkams are made in a similar way. That means the patram will be crushed and put in the that arka yantram, and it will be just immersed by water. Only that much quantity is used.
So, like, Arka Prakashan reference is classically it is being prepared, sir?
Yes, that person is doing that work specifically.
Okay, sir.
Sir, namaste, sir. You told about asava nasya and pakpadosha nirhavana, sir. So can you please explain which sort of asavas can be used, what quantities in the form of nasya?
Thank you. Asava nasya is one of the forms of nasyas to eliminate the dushta kapha from the nose. Usually nimbasava is preferred. Nimbasava is easily available. Most of the area-based companies produce them. But the problem is it may irritate and produce some pain or headache. Because initially we should start with a few drops around 0.5 ml or up to 1 ml. Gradually for 3 or 4 days increase the dosage, and when the patient starts getting severe pain after this nimbasava or asava nasya, stop it. That indicates that patient's kapha has been cleared. Till then, usually with 3 or 4 days patient feels better while increasing the Arohana Krama. So 0.5 ml, 1 ml, 2 ml, 3 ml or 4 ml, the patient feels completely normal. Then we can stop. It will not continue for a lot of days, 4 or 5 days, maximum 7 days. This is to remove the accumulated kapha. But many times if OST is blocked, we should be careful, because in chronic patients in CT scanning, OST is blocked. Immediately on the first day itself, patient feels terribly painful, small doses. At that time, better to stop. But if the pain is tolerable or he feels the flood is coming out, accumulated sinus becomes clear, and his breathing pattern becomes normal, obstruction is reduced the next day, then there is no issues at all. Usually we practice nimbasava nasya and pradhamana nasya, various types of pradhamana. There is easier method is take a small ball pen cover and add your BP apparatus cuff to the end, and to the one end you just take one pinch initially. First, actually pradhamana nasya with a small form, not in grams together. One pinch start with, keep it to one end of the pen, and the other end you fix the BP apparatus cuff. Just make a pushing movement. Immediately the pradhamana nasya. It gives very accurate results. Not in Dustapratishaya, as it is in allergic rhinitis. We call it as a shower. Allergic rhinitis, we don't consider it as a type of Dustapratishaya. It's a shower. In shower too, there are no other symptoms. Only thing is patient will have repeated sneezing. No other Dustapratishaya symptoms will be there, and it's a periodical. some seasonal antibiotic for 1 week or so. You will have very severe. When the season changes, you will be all right. In those things, 2 or 3 sittings is quite sufficient. And the next season, maybe after 8 months or 10 months, ask the patient to come again, because most of these patients are addicted to decongestant, Nestovion or various steroidal anti-inflammatory drops or cetirizine or similar levocetirizine. Or some people are even with wetness or they suppress the symptoms. Instead of suppressing, we can give a long-lasting. For example, 2 or 3 sittings of this one. Better to do it in our clinics instead of asking the patient, because patient may not do it properly and complications may arise. So initially for 2 or 3 days we can do it in our clinic itself. Later on we can switch over to our therapy or some internal medicine. And after, again, if it relaxes after a few days or few months, we can do another 1 or 2 days sittings. So the approach of indications of navalness is not in the early stages, it's only at the later stages. Initially these 2 are useful, Pradhamanasya and Asavanasya. Thank you.
I can add one point to that question. It is about the use of various types of kashaya neti. Along with the proper shamana chikitsa, you can use various types of kashayas in the form of neti. Neti you all know, isn't it? Neti, which gives many things, even Triphala with the Haridra, Guapam, all these Kramihara Guapams, you can use as neti, which gives extraordinary outcome.
Sir, as you explained about neti, or when you give importance to neti, there is a reference of nasa sechana. How can you conclude that it about neti or sechana? There is a difference between neti and sechana. They are given importance and there is a reference of sechana. How could you explain it and how it is important in nasa roga chikitsa?
This is a reference to nasa sechana.
Nasa pana in Ardita. Masha Badari, Nasa Pana. That is for the Ardita. The same thing is also applicable in many chronic sciences. That is to take it internally to the moon, not need. Nasa Pana is different. It is indicated in Ardita.
It's a yogic procedure. You is nasa sechana. I don't know which reference you are specifically.
Nasa Piti.
In any case, I think this neti may be having a sechana property as well as the specific aushadha also. So it may be giving both. It is a partially, it is a sechana karma, but the medicine used is very important. See, plain water which you intend to use as a sechana may not be giving the desired outcome in Dustapratishaya when done as neti. I do not know which is the reference, but about the nasa sechana you are mentioning. If you show me, I can comment.
I'll get to it.
Please, please.
Thank you.
हेलो सर, प्रसाद सर आपके लिए प्रश्न है। ये 3 सवाल है प्रश्न, 3 प्रश्न है।
Okay. I hope the organizers will permit that for the constraint of timing, please.
एक पहला प्रश्न मंत्र चिकित्सा के बारे में कुछ बताइए। आप मंत्र चिकित्सा।
Oh, I think Saurav is responsible for that.
दूसरा सर, आपने एक चिकित्सा मंजरी बुक का एक रेफरेंस बताया था, तो वो इंग्लिश में है या नहीं?
No, it is not available.
तीसरा सर, एक दुष्ट प्रतिशाय में आप मांस में धातु की दृष्टि हुई है या मांस में का दोष हुए है, कैसे समझे?
Yes, see, they are from recta onwards, recta, mamsa and megas are the 3 dhatus which attracts the krimis very easily. They are supposed to be the snehas which get afflicted by the pitta kapha koma very easily, attracting the krimis. And from observing the various types of discharges at different levels of Dustapratishaya, we can assume that it is not just about the rasa, it is about the rakta. At this point, there is mamsa involvement, there megas involvement. And interestingly, along with that, when this mamsa and megas is getting rotten in this particular samrati, parallel to that, you can find mamsa and megas and megakshaya in the other parts of the sharira also. So these are all inference based. Regarding mantra chikitsa, mantrodesam and details should not be given in a public. So I will discuss it in person later.
Thank you, sir. Now we will be concluding this session. So at this juncture, I remember one quotation. Ayam nija kalometi ganana laguchetasam udana charitanam tu vasudhaiva kutumbakam. Like it is the Sanatana Dharma, how we have understood. Like this is mine, this is yours. That concept will never hold good. So the same if we do apply to our science, that is I am Sharagi, you are a Chikitsa person, you are Sharya person. Let us not do that practically. Leaving apart the departmental protocols and all, the thorough discussion, whatever we have witnessed till now for more than 2 hours, will definitely help us in our daily clinical practice. And I once again thank both our respected speakers who have given enormous knowledge regarding what it was a wonderful session, sir. Really wonderful. I hope it will be helping each and every practitioner here who wants to practice Ayurveda genuinely. And I would like to thank Dr. Saurabh and his organizing team for giving me an opportunity to be here with both the speakers. I myself have learned many new things here. I once again would like to thank organizers. Thank you. Thank you, Anna.
Yes, the session was truly insightful. We thank you, the moderator, Laxmi Patil ma'am, and also the speakers, Dr. Uday Shankar sir and Dr. Prasad sir. So now I request Dr. Sambhasha sir to felicitate all the three eminent Uttama Shalakis present here.